A heartbreaking goodbye between mother and daughter shared with the world through social media. Tonight, what doctors want you to learn from country singer Joey Feek's final days here on Earth. And a husband's blog is giving us a glimpse into some of the most intimate moments of a dying woman's final moments. We're going to talk to a great doctor about the conversation you should be having after seeing Joey and Rory Feek's story. All right, tonight, your social media feeds are flooded with this picture. It shows the moment earlier this week when country singer Joey Feek said goodbye to her 2-year-old daughter, Indiana. Joey's husband, Rory, posted the picture on his blog with the caption, "One last kiss." Together, the husband and wife team made up the Grammy-nominated country duo Joey and Rory. Shortly after their daughter was born, the couple learned that Joey had cervical cancer. The disease spread to her colon, and in November, the Feeks opted to end Joey's treatment for stage 4 cancer. In Rory's latest blog, he says his wife is now in a deep sleep and isn't expected to wake up. She wanted to live long enough to celebrate her daughter's 2nd birthday, and they did that 2 weeks ago. Rory writes that he and Joey are at peace with where she is going. And Joey's heartbreaking story is leading families and couples to talk about end-of-life care, and the blog Rory is sharing with the world is giving us an inside look at what's known as palliative care. Death, it's a sensitive and emotional topic, but it's a reality that we all have to face. And joining us right now to help put this end-of-life care in focus is the great Dr. Christopher Kearney, palliative medicine specialist with MedStar Health. Not the icebreaker we want, is it? This is tough.
It is a very sad story, Jamie, and I appreciate the opportunity at least to come and talk a little bit about what your viewers would be most interested in. Palliative medicine is a relatively new concept, it seems to us, but it's an old concept. It's caring for the whole person. So the moment that this woman found out that she had cervical cancer and a newborn, her life changed dramatically, just as when you and I talked before, that would be the same for you and I.
But it's different than hospice.
Correct. So palliative medicine is actually the larger circle that would involve care for the whole person. Hospice care is left for the patient who is really at end of life, as this woman is, without further treatment options or benefit from further treatment. Palliative medicine would hope to be involved with patients with serious illness. The day that someone tells you you have lung cancer, your life has changed, your family's life has changed, and it's not now just about radiation or chemo or surgery. It's about you being a father, you being a newscaster. Things have all been thrown into chaos.
But doctor, we go through life, hey, nothing's going to happen, we're good, and then it hits. So we should be talking about this. Or, you know, hey, honey, let's sit down and have this talk tonight while we both can.
That's right. And I believe in this case, that is exactly what happened. Even though she did go through maximal treatment, there came a time where the treatments were no longer beneficial for her, and someone took the time to say, you are still in control, this is your life, you can live it out in the most dignified way. How do you want to do it? So that's what we would do as palliative medicine people. We would sit down to talk, to say, how do you want to spend your valuable time?
So you're treating the mind, not just the disease.
The mind, the spirit, the body, because symptom management is still very important. We hear talk about people wanting to end their lives prematurely, not in this case, but that's usually not the case. If most people can be kept out of pain and can be kept comfortable, then they want to stay around as long as they can. So that's part of palliative medicine. Good pain management, good symptom management, then also honest talk about what is coming and how the patient and their family can remain in control of that.
Be honest with me. How do you do it? How do you do it personally?
So I teach residents and medical students every day, and they would ask me that same question, don't I go home depressed or sad? I actually don't. I would say if I wasn't doing this work, if we weren't having open and honest conversations, and then I would feel depressed, or I would be despondent. But the fact that we can tell people in the best way how to care for them, for their valuable time, whatever they have left in the world, in an open human way, human beings taking care of other human beings, then I go home fine.
Thank you. You're one of my favorites. I thank you very much for coming in here and sharing that. I think you put the issue out there, have the talk, get everything in order, just in case. Thank you.
You're welcome.
All right, let's take a look at weather now.